Hi, it's Greg here, and I'm just going to cover over some risks of getting your teeth straightened today. I know we're looking forward to getting them lovely and straight and lovely looking for you, but we must cover over some of the risks that are involved before you start. So, um, one I do want to show you, not so much a risk of treatment, but just something that we may have to do for you, and that is make a little bit of space. This is a procedure called IPR, which is interproximal reduction. You don't need to know that so much, but what you do need to understand is that we could have to shave off a little bit of the tooth. We won't do more than 0.5 of a millimeter, and the idea here is that we have some space then to line the teeth up. We don't want to push the teeth further forward. So if we don't do this, and sometimes we will avoid it where we can, but sometimes if you don't want us to do this, it would mean the teeth would need to be a little further forward to get them straightened up with an increased risk of gum recession. Um, we believe that this procedure doesn't cause any long-term harm to the tooth or any long-term risk of decay. Um, if done correctly, obviously, as we would do it. But it's something that I understand, you know, not everyone wants, and I guess nobody likes, but it's something that we will discuss with you and consider. Another thing we talk about right at the start is the fact that we can get your teeth straight, but they will want to go back to where they came from. So very important to wear the retainers that we make you afterwards, because otherwise the teeth will move. And sometimes even with retainers they move. They can be quite difficult to keep in position. So vital that especially in the first year or two, these are worn, religiously every night if possible. As time goes on, you should always have a retainer. You should always be able to put that in, check that the teeth aren't moving, hold them in position. So there is a lifelong commitment there that we need to make to keep them in place. Again, not a risk here, but just something that we will do to your teeth. We will put some attachments onto the teeth, and this helps the Invisalign stay in place, and it helps the teeth get moved in the direction we want them to. We do that by putting a cleaning gel on there, a resin, and then we put these resin attachments are glued onto the teeth. We set them with that blue light, and then you have these resin blocks that are on the teeth. Yeah, that's individual to everyone. Yours will be different to everyone else's. Some people have more, some have less. We try and keep them to a minimum if we can, but they are very useful to get the teeth moved correctly and to get you the best results possible. Obviously, there's the discomfort in moving teeth, but one of the risks that people don't appreciate is something we call root resorption. So here the root of the tooth can be shortened by moving the teeth, and in fact it happened to my teeth when I had braces as a teenager for quite a prolonged time. The roots were shortened. The risks of this happening with Invisalign are much lower. The treatments aren't as long, and we aren't generally moving the teeth as far as some other treatments. But whenever we move a tooth, there's a risk of this happening. It doesn't cause the tooth to be painful or it shouldn't cause any long-term problems. I mean, for me, my teeth feel and look exactly the same. But if I were to develop gum disease and my bones started to shrink back and be lost from this side, obviously I'd get to the end of that tooth earlier and the tooth would fall out, a little quicker than it would have otherwise. Cleaning wise, with Invisalign, it's fairly straightforward. You clean your teeth as normal, so you can brush and floss as normal, and that means that the risks of decay and gum disease are quite minimal, or the risks of those becoming worse. Obviously, you have to be careful not to eat sugary things or drink sugary things with the aligners in. They may get trapped around the teeth then, but that's not generally a problem that we have. Another risk I like to show people is something we call black triangles, and that means that when the teeth are aligned, you might have that space between the teeth, which if the teeth were crossed over before, wasn't there. And that's due to the natural shape of the tooth. We can't really prevent those occurring. Sometimes we can use that IPR, that shaving of the teeth, to flatten the side of the tooth so that we can bring them closer together. But it's not always possible to prevent these, especially if you have had some gum recession previously. And if they are present, they can be filled in. So this little video shows the process of doing some resin bonding to close that space up. So that's an option. I'll discuss with you whether this is something that is likely to happen for you or not. Hopefully not, and hopefully you wouldn't have to do this. But it is a risk with straightening teeth. And again, there is something we can do about it if needed. I think that covers off most of the risks. We'll make sure you understand those, and we'll discuss these with you. But I hope those videos have just made things a little easier to understand.